Q2. Which drug is used as an antidote in paracetamol poisoning? A. Atropine. B. Naloxone. C. N-acetylcysteine. D. Flumazenil. N-acetylcysteine. Q3. Which antibiotic inhibits bacterial cell wall synthesis? A. Tetracycline. B. Penicillin. C. Chloramphenicol. D. Erythromycin. Penicillin. Q4. Which drug is a loop diuretic? A. Furosemide. B. Spironolactone. C. Hydrochlorothiazide. D. Mannitol. Furosemide. Q5. Which drug is used in asthma as a bronchodilator? A. Salbutamol. B. Atenolol. C. Enalapril. D. Losartan. Salbutamol. Q6. Which drug is a proton pump inhibitor? A. Ranitidine. B. Omeprazole. C. Cimetidine. D. Famotidine. Omeprazole. Q7. Which drug is used in Parkinson's disease? A. Levodopa. B. Diazepam. C. Phenytoin. D. Haloperidol. Levodopa. Q8. Which drug is a benzodiazepine? A. Diazepam. B. Morphine. C. Aspirin. D. Ibuprofen. Diazepam. Q9. Which drug is an opioid analgesic? A. Morphine. B. Paracetamol. C. Diclofenac. D. Aspirin. Morphine. Q10. Which drug is used for hypertension? A. Amlodipine. B. Salbutamol. C. Omeprazole. D. Diazepam. Amlodipine. Q11. Which drug is an H1 antihistamine? A. Cetirizine. B. Ranitidine. C. Omeprazole. D. Atropine. Cetirizine. Q12. Which drug is used in epilepsy? A. Phenytoin. B. Atenolol. C. Insulin. D. Digoxin. Phenytoin. Q13. Which drug is a calcium channel blocker? A. Verapamil. B. Enalapril. C. Losartan. D. Atenolol. Verapamil. Q14. Which drug is an ACE inhibitor? A. Enalapril. B. Amlodipine. C. Propranolol. D. Digoxin. Enalapril. Q15. Which drug is an ARB? A. Losartan. B. Enalapril. C. Atenolol. D. Verapamil. Losartan. Q16. Which drug is used as an anticoagulant? A. Heparin. B. Aspirin. C. Paracetamol. D. Morphine. Heparin. Q17. Which drug is a statin? A. Atorvastatin. B. Metformin. C. Glibenclamide. D. Insulin. Atorvastatin. Q18. Which drug is used in diabetes? A. Metformin. B. Atenolol. C. Diazepam. D. Omeprazole. Metformin. Q19. Which drug is a sulfonylurea? A. Glibenclamide. B. Insulin. C. Metformin. D. Acarbose. Glibenclamide. Q20. Which drug is a corticosteroid? A. Prednisolone. B. Paracetamol. C. Aspirin. D. Diclofenac. Prednisolone. Q21. Which drug is used in tuberculosis? A. Isoniazid. B. Amoxicillin. C. Ciprofloxacin. D. Azithromycin. Isoniazid. Q22. Which drug is an aminoglycoside? A. Gentamicin. B. Penicillin. C. Tetracycline. D. Chloramphenicol. Gentamicin. Q23. Which drug is a macrolide? A. Azithromycin. B. Floxacin. C. Gentamicin. D. Doxycycline. Azithromycin. Q24. Which drug is a fluoroquinolone? A. Ciprofloxacin. B. Amoxicillin. C. Erythromycin. D. Vancomycin. Ciprofloxacin. Q25. Which drug is a tetracycline? A. Doxycycline. B. Penicillin. C. Azithromycin. D. Ceftriaxone. Doxycycline. Q26. Which drug is an antifungal? A. Fluconazole. B. Acyclovir. C. Zidovudine. D. Rifampicin. Fluconazole. Q27. Which drug is an antiviral? A. Acyclovir. B. Fluconazole. C. Metronidazole. D. Amoxicillin. Acyclovir. Q28. Which drug is an antimalarial? A. Chloroquine. B. Ciprofloxacin. C. Isoniazid. D. Fluconazole. Chloroquine. Q29. Which drug is an antiemetic? A. Ondansetron. B. Metformin. C. Aspirin. D. Diazepam. Ondansetron. Q30. Which drug is a laxative? A. Lactulose. B. Omeprazole. C. Ranitidine. D. Atropine. Lactulose. Q31. Which drug is an anticholinergic? A. Atropine. B. Pilocarpine. C. Neostigmine. D. Physostigmine. Atropine. Q32. Which drug is a cholinergic agonist? A. Pilocarpine. B. Atropine. C. Propranolol. D. Diazepam. Pilocarpine. Q33. Which drug is a beta-1 selective blocker? A. Atenolol. B. Propranolol. C. Timolol. D. Nadolol. Atenolol. Q34. Which drug has a vasodilator? A. Nitroglycerin. B. Digoxin. C. Ethanol. D. Insulin. Ans. Nitroglycerin. Q35. Which drug is used in heart failure? A. Digoxin. B. Diazepam. C. Paracetamol. D. Omeprazole. Ans. Digoxin. Q36. Which drug has a local anesthetic? A. Lidocaine. B. Morphine. C. Aspirin. D. Diazepam. Ans. Lidocaine. Q37. Which drug is a general anesthetic? A. Propofol. B. Paracetamol. C. Ibuprofen. D. Aspirin. Ans. Propofol. Q38. Which drug is an NSAID? A. Ibuprofen. B. Morphine. C. Diazepam. D. Atropine. Ans. Ibuprofen. Q39. Which drug is an antiplatelet? A. Aspirin. B. Heparin. C. Warfarin. D. Morphine. Ans. Aspirin. Q40. Which drug is a thrombolytic? A. Streptokinase. B. Aspirin. C. Heparin. D. Clopidogrel. Ans. Streptokinase. Q41. Which drug is an immunosuppressant? A. Cyclosporine. B. Paracetamol. C. Ibuprofen. D. Aspirin. Ans. Cyclosporine. Q42. Which drug is used in gout? A. Allopurinol. B. Metformin. C. Atenolol. D. Omeprazole. Ans. Allopurinol. Q43. Which drug is a bronchodilator? A. Theophylline. B. Propanolol. C. Atenolol. D. Enalapril. Ans. Theophylline. Q44. Which drug is a mucolytic? A. Acetylcysteine. B. Diazepam. C. Paracetamol. D. Aspirin. Ans. Acetylcysteine. Q45. Which drug is used in hypothyroidism? A. Levothyroxine. B. Carbimazole. C. Propanolol. D. Atenolol. Ans. Levothyroxine. Q46. Which drug is used in hypothyroidism? A. Carbimazole. B. Levothyroxine. C. Insulin. D. Metformin. Ans. Carbimazole. Q47. Which drug is a muscle relaxant? A. Baclofen. B. Diazepam. C. Morphine. D. Aspirin. Ans. Baclofen. Q48. Which drug is an antidepressant? A. Fluoxetine. B. Diazepam. C. Haloperidol. D. Phenytoin. Ans. Fluoxetine. Q49. Which drug is an antipsychotic? A. Haloperidol. B. Fluoxetine. C. Diazepam. D. Paracetamol. Ans. Haloperidol. Q50. Which drug is used in Alzheimer's disease? A. Donepezil. B. Levodopa. C. Diazepam. D. Haloperidol. Ans. Donepezil. Q50. Disease. A. Donepezil. B. Levodopa. C. Diazepam. D. Haloperidol. Ans. Donepezil. Q51. Which drug is a beta-2 agonist? A. Salmeterol. B. Atenolol. C. Propanolol. D. Verapamil. Ans. Salmeterol. Which drug is a potassium-sparing diuretic? Spironolactone. B. Furosemide. C. Mannitol. D. Hydrochlorothiazide. Ans. Spironolactone. Q53. Which drug is used in angina? A. Nitroglycerin. B. Digoxin. C. Atropine. D. Diazepam. Ans. Nitroglycerin. Q54. Which drug is a cardiac glycoside? A. Digoxin. B. Atenolol. C. Enalapril. D. Losartan. Ans. Digoxin. Q55. Which drug is used for hyperlipidemia? A. Simvastatin. B. Metformin. C. Insulin. D. Glibenclamide. Ans. Simvastatin. Q56. Which drug is a biguanide? A. Metformin. B. Insulin. C. Glipizide. D. Pioglitazone. Ans. Metformin. Q57. Which drug is a thiazolidinedione? A. Pioglitazone. B. Metformin. C. Insulin. D. Glibenclamide. Ans. Pioglitazone. Q58. Which drug is an alpha blocker? A. Prazosin. B. Propanolol. C. Atenolol. D. Metoprolol. Ans. Prazosin. Q59. Which drug is a beta blocker? A. Propanolol. B. Amlodipine. C. Verapamil. D. Enalapril. Ans. Propanolol. Q60. Which drug is used in glaucoma? A. Timolol. B. Atropine. C. Pilocarpine. D. Propanolol. Ans. Timolol. Q61. Which drug is a meiotic agent? A. Pilocarpine. B. Atropine. C. Tropicamide. D. Hometropine. Ans. Pilocarpine. Q62. Which drug is a mydriatic? A. Atropine. B. Pilocarpine. C. Neostigmine. D. Physostigmine. Ans. Atropine. Q63. Which drug is used as a muscle relaxant? A. Dantrolene. B. Diazepam. C. Baclofen. D. Morphine. Ans. Dantrolene. Q64. Which drug is used in malignant hyperthermia? A. Dantrolene. B. Atropine. C. Diazepam. D. Propanolol. Ans. Dantrolene. Q65. Which drug is a selective serotonin reuptake inhibitor? A. Fluoxetine. B. Diazepam. C. Haloperidol. D. Amitriptyline. ANS. Fluoxetine. Q66. Which drug is a tricyclic antidepressant? A. Amitriptyline. B. Fluoxetine. C. Sertraline. D. Escitalopram. ANS. Amitriptyline. Q67. Which drug is an antipsychotic? A. Chlorpromazine. B. Diazepam. C. Fluoxetine. D. Paracetamol. ANS. Chlorpromazine. Q68. Which drug is a mood stabilizer? A. Lithium. B. Diazepam. C. Haloperidol. D. Fluoxetine. ANS. Lithium. Q69. Which drug is used in anxiety? A. Diazepam. B. Haloperidol. C. Fluoxetine. D. Phenytoin. ANS. Diazepam. Q70. Which drug is an H2 receptor blocker? A. Ranitidine. B. Omeprazole. C. Pantoprazole. D. Lansoprazole. ANS. Ranitidine. Q71. Which drug is used in peptic ulcer? A. Omeprazole. B. Aspirin. C. Ibuprofen. D. Diclofenac. ANS. Omeprazole. Q72. Which drug is a prokinetic agent? A. Metoclopramide. B. Ondansetron. C. Domperidone. D. Atropine. ANS. Metoclopramide. Q73. Which drug is an antidiarrheal? A. Loperamide. B. Lactulose. C. Omeprazole. D. Ranitidine. ANS. Loperamide. Q74. Which drug is used in constipation? A. Bisacodyl. B. Loperamide. C. Atropine. D. Ondansetron. ANS. Bisacodyl. Q75. Which drug is an antitussive? A. Codeine. B. Salbutamol. C. Theophylline. D. Montelukast. ANS. Codeine. Q76. Which drug is a leukotriene antagonist? A. Montelukast. B. Salbutamol. C. Ipratropium. D. Theophylline. ANS. Montelukast. Q77. Which drug is an anticholinergic bronchodilator? A. Ipratropium. B. Salbutamol. C. Theophylline. D. Montelukast. ANS. Ipratropium. Q78. Which drug is used in COPD? A. Tiotropium. B. Atenolol. C. Enalapril. D. Digoxin. ANS. Tiotropium. Q79. Which drug is an expectorant? A. Guaifenesin. B. Codeine. C. Dextromethorphan. D. Morphine. ANS. Guaifenesin. Q80. Which drug is used in anemia? A. Ferrous sulfate. B. Metformin. C. Insulin. D. Atenolol. ANS. Ferrous sulfate. Q81. Which drug is a vitamin D analog? A. Calcitriol. B. Retinol. C. Thiamine. D. Niacin. ANS. Calcitriol. Q82. Which drug is used in osteoporosis? A. Alendronate. B. Calcium carbonate. C. Vitamin C. D. Iron. ANS. Alendronate. Q83. Which drug is an antiplatelet? A. Clopidogrel. B. Heparin. C. Warfarin. D. Streptokinase. ANS. Clopidogrel. Q84. Which drug is an oral anticoagulant? A. Warfarin. B. Heparin. C. Aspirin. D. Clopidogrel. ANS. Warfarin. Q85. Which drug is used in shock? A. Dopamine. B. Atenolol. C. Propanolol. D. Verapamil. ANS. Dopamine. Q86. Which drug is a vasoconstrictor? A. Adrenaline. B. Nitroglycerin. C. Amlodipine. D. Verapamil. ANS. Adrenaline. Q87. Which drug is a beta agonist? A. Isoproterenol. B. Propanolol. C. Atenolol. D. Metoprolol. ANS. Isoproterenol. Q88. Which drug is used in anaphylaxis? A. Adrenaline. B. Atropine. C. Diazepam. D. Morphine. ANS. Adrenaline. Q89. Which drug is an alpha agonist? A. Phenylephrine. B. Prazosin. C. Propanolol. D. Atenolol. ANS. Phenylephrine. Q90. Which drug is used in migraine? A. Sumatrapan. B. Paracetamol. C. Ibuprofen. D. Aspirin. ANS. Sumatrapan. Q91. Which drug is used in motion sickness? A. Scopolamine. B. Atropine. C. Diazepam. D. Morphine. ANS. Scopolamine. Q92. Which drug is an antiepileptic? A. Valproate. B. Diazepam. C. Fluoxetine. D. Haloperidol. ANS. Valproate. Q93. Which drug is a barbiturate? A. Phenobarbital. B. Diazepam. C. Lorazepam. D. Alprazolam. ANS. Phenobarbital. Q94. Which drug is a benzodiazepine? A. Lorazepam. B. Phenobarbital. C. Phenytoin. D. Valproate. ANS. Lorazepam. Q95. Which drug is used in schizophrenia? A. Haloperidol. B. Fluoxetine. C. Diazepam. D. Amitriptyline. ANS. Haloperidol. Q96. Which drug is used in depression? A. Diazepam. C. Haloperidol. D. Phenytoin. Ans. Sertraline. Q97. Which drug is a sedative? A. Midazolam. B. Fluoxetine. C. Haloperidol. D. Aspirin. Ans. Midazolam. Q98. Which drug is an analgesic? A. Paracetamol. B. Diazepam. C. Fluoxetine. D. Haloperidol. Ans. Paracetamol. Q99. Which drug is an anti-inflammatory? A. Diclofenac. B. Morphine. C. Diazepam. D. Atropine. Ans. Diclofenac. Q100. Which drug is an antipyretic? A. Paracetamol. B. Ibuprofen. C. Aspirin. D. Diclofenac. Ans. Paracetamol. Q100. Which drug is a selective COX-2 inhibitor? A. Celecoxib. B. Aspirin. C. Ibuprofen. D. Diclofenac. Ans. Celecoxib. Q101. Which drug is used in angina? A. Nitroglycerin. B. Atenolol. C. Enalapril. D. Digoxin. Ans. Nitroglycerin. Q102. Which drug is a potassium-sparing diuretic? A. Spironolactone. B. Furosemide. C. Mannitol. D. Hydrochlorothiazide. Ans. Spironolactone. Q103. Which drug is used in glaucoma? A. Timolol. B. Propanolol. C. Atenolol. D. Metoprolol. Ans. Timolol. Q104. Which drug is an alpha-1 blocker? A. Prazosin. B. Propanolol. C. Atenolol. D. Clonidine. Ans. Prazosin. Q105. Which drug is used in hypertensive emergency? A. Nitroprusside. B. Amlodipine. C. Atenolol. D. Enalapril. Ans. Nitroprusside. Q106. Which drug is a cardiac glycoside? A. Digoxin. Atropine. C. Morphine. D. Diazepam. Ans. Digoxin. Q107. Which drug is used in arrhythmia? A. Amiodarone. B. Paracetamol. C. Ibuprofen. D. Aspirin. Ans. Amiodarone. Q108. Which drug is an angiotensin beta blocker? A. Atenolol. B. Salbutamol. C. Atropine. D. Diazepam. Ans. Atenolol. Q109. Which drug is a vasopressor? A. Dopamine. B. Amlodipine. C. Enalapril. D. Losartan. Ans. Dopamine. Q110. Which drug is used in shock? A. Noradrenaline. B. Paracetamol. C. Ibuprofen. D. Aspirin. Ans. Noradrenaline. Q111. Which drug is a thrombin inhibitor? A. Dabigatran. B. Warfarin. C. Aspirin. D. Heparin. Ans. Dabigatran. Q112. Which drug is a vitamin K antagonist? A. Warfarin. B. Heparin. C. Aspirin. D. Clopidogrel. Ans. Warfarin. Q113. Which drug is AP2Y12 inhibitor? A. Clopidogrel. B. Aspirin. C. Heparin. D. Warfarin. Ans. Clopidogrel. Q114. Which drug is used in iron deficiency anemia? A. Ferrous sulfate. B. Vitamin B12. C. Folic acid. D. Calcium. Ans. Ferrous sulfate. Q115. Which drug is used in megaloblastic anemia? A. Folic acid. B. Iron. C. Calcium. D. Vitamin C. Ans. Folic acid. Q116. Which drug is used in pernicious anemia? A. Vitamin B12. B. Iron. C. Folic acid. D. Calcium. Ans. Vitamin B12. Q117. Which drug is used in peptic ulcer? A. Omeprazole. B. Aspirin. C. Ibuprofen. D. Paracetamol. Ans. Omeprazole. Q118. Which drug is an H2 blocker? A. Ranitidine. B. Omeprazole. C. Pantoprazole. D. Esomeprazole. Ans. Ranitidine. Q119. Which drug is a prokinetic? A. Metoclopramide. B. Ondansetron. C. Diazepam. D. Atropine. Ans. Metoclopramide. Q120. Which drug is used in diarrhea? A. Loperamide. B. Lactulose. C. Omeprazole. D. Ranitidine. Ans. Loperamide. Q121. Which drug is an anti-amoebic? A. Metronidazole. B. Amoxicillin. C. Ciprofloxacin. D. Azithromycin. Ans. Metronidazole. Q122. Which drug is used in H. pylori infection? A. Clarithromycin. B. Paracetamol. C. Ibuprofen. D. Aspirin. Ans. Clarithromycin. Q123. Which drug is a cephalosporin? A. Ceftriaxone. B. Amoxicillin. C. Ciprofloxacin. D. Doxycycline. Ans. Ceftriaxone. Q124. Which drug has a carbapenem? A. Imipenem, B. Penicillin, C. Tetracycline, D. Chloramphenicol, UNS. Imipenem. Q125. Which drug is a glycopeptide antibiotic? A. Vancomycin, B. Penicillin, C. Ciprofloxacin, D. Azithromycin, UNS. Vancomycin. Q126. Which drug is used in MRSA infection? A. Vancomycin, B. Amoxicillin, C. Penicillin, D. Ceftriaxone, UNS. Vancomycin. Q127. Which drug is a linezolid class antibiotic? A. Linezolid, B. Ciprofloxacin, C. Amoxicillin, D. Azithromycin, UNS. Linezolid. Q128. Which drug is an antifungal palyme? A. Amphotericin, B. B. Fluconazole, C. Ketoconazole, D. Intraconazole, UNS. Amphotericin B. Q129. Which drug is an azole antifungal? A. Ketoconazole, B. Amphotericin, B. C. Nystatin, D. Grizofulvan, UNS. Ketoconazole. Q130. Which drug is used in herpes infection? A. Acyclovir, B. Zidovudine, C. Nevirapine, D. Efavirenz, UNS. Acyclovir. Q131. Which drug is an anti-HIV drug? A. Zidovudine, B. Acyclovir, C. Fluconazole, D. Rifampicin, UNS. Zidovudine. Q132. Which drug is a protease inhibitor? A. Ritonavir, B. Zidovudine, C. Acyclovir, D. Nevirapine, UNS. Ritonavir. Q133. Which drug is used in malarial prophylaxis? A. Floquine, B. Metronidazole, C. Ciprofloxacin, D. Azithromycin, UNS. Mefloquine. Q134. Which drug is used in severe malaria? A. Arsenate, B. Chloroquine, C. Primicine, D. Quinine, UNS. Arsenate. Q135. Which drug is an anthelmintic? A. Albendazole, B. Metformin, C. Atenolol, D. Omeprazole, UNS. Albendazole. Q136. Which drug is used in filariasis? A. Diethylcarbamazine, B. Albendazole, C. Ivermectin, D. Praziquantel, UNS. Diethylcarbamazine. Q137. Which drug is an antidiabetic insulin? A. Regular insulin, B. Metformin, C. Glibenclamide, D. Pioglitazone, UNS. Regular insulin. Q138. Which drug is a DPP-4 inhibitor? A. Sitagliptin, B. Metformin, C. Insulin, D. Glibenclamide, UNS. Sitagliptin. Q139. Which drug is a GLP-1 agonist? A. Liraglutide, B. Metformin, C. Insulin, D. Pioglitazone, UNS. Liraglutide. Q140. Which drug is a thiazolidinedione? A. Pioglitazone, B. Metformin, C. Insulin, D. Glibenclamide, UNS. Pioglitazone. Q141. Which drug is a biguanide? A. Metformin, B. Glibenclamide, C. Insulin, D. Pioglitazone, UNS. Metformin. Q142. Which drug is used in diabetic ketoacidosis? A. Insulin, B. Metformin, C. Pioglitazone, D. Sitagliptin, UNS. Insulin. Q143. Which drug is used in hypothyroidism? A. Levothyroxine, B. Carbimazole, C. Propranolol, D. Atenolol, UNS. Levothyroxine. Q144. Which drug is used in hypothyroidism? A. Propylthiouracil, B. Levothyroxine, C. Insulin, D. Metformin, UNS. Propylthiouracil. Q145. Which drug is used in Cushing syndrome? A. Ketoconazole, B. Prednisolone, C. Hydrocortisone, D. Dexamethasone, UNS. Ketoconazole. Q146. Which drug is used in Addison disease? A. Hydrocortisone, B. Ketoconazole, C. Prednisolone, D. Dexamethasone, UNS. Hydrocortisone. Q147. Which drug is a mineralocorticoid? A. Fludrocortisone, B. Prednisolone, C. Dexamethasone, D. Hydrocortisone, UNS. Fludrocortisone. Q148. Which drug is used in osteoporosis? A. Alendronate, B. Calcium, C. Vitamin D. D. All of the above, UNS. Alendronate. Q149. Which drug is a selective estrogen receptor modulator? A. Tamoxifen, C. Progesterone, D. Testosterone, UNS. Tamoxifen. Q150. Which drug is an oral contraceptive? A. Ethinyl estradiol, B. Testosterone, C. Progesterone, D. Insulin, UNS. Ethinyl estradiol. Q150. Which drug is an oral contraceptive? A ethinyl estradiol, B testosterone, C progesterone, D insulin, ANS ethinyl estradiol. Q151. Which drug is a progestin? A medroxyprogesterone, B estrogen, C testosterone, D insulin, ANS medroxyprogesterone. Q152. Which drug is an androgen? A testosterone, B estrogen, C progesterone, D insulin, ANS testosterone. Q153. Which drug is used in breast cancer? A tamoxifen, B insulin, C metformin, D atenolol, ANS tamoxifen. Q154. Which drug is used in prostate cancer? A flutamide, B estrogen, C progesterone, D insulin, ANS flutamide. Q155. Which drug is a GnRH agonist? A leuprolide, B tamoxifen, C testosterone, D insulin, ANS leuprolide. Q156. Which drug is an aromatase inhibitor? A anastrozole, B tamoxifen, C estrogen, D progesterone, ANS anastrozole. Q157. Which drug is used in erectile dysfunction? A sildenafil, B atenolol, C metformin, D omeprazole, ANS sildenafil. Q158. Which drug is used in benign prostatic hyperplasia? A finasteride, B tamoxifen, C testosterone, D estrogen, ANS finasteride. Q159. Which drug is a 5-alpha reductase inhibitor? A finasteride, B flutamide, C testosterone, D progesterone, ANS finasteride. Q160. Which drug is used in uterine bleeding? A tranexamic acid, B heparin, C warfarin, D aspirin, ANS tranexamic acid. Q161. Which drug is an oxytocic? A oxytocin, B progesterone, C estrogen, D testosterone, ANS oxytocin. Q162. Which drug is used for medical abortion? A mifepristone, B estrogen, C progesterone, D testosterone, ANS mifepristone. Q163. Which drug is a prostaglandin analog? A misoprostol, B oxytocin, C estrogen, D progesterone, ANS misoprostol. Q164. Which drug is used in postpartum hemorrhage? A oxytocin, B insulin, C atenolol, D metformin, ANS oxytocin. Q165. Which drug is an antihistamine H2 blocker? A ranitidine, B cetirizine, C loratadine, diphenhydramine, ANS ranitidine. Q166. Which drug is a first-generation antihistamine? A diphenhydramine, B cetirizine, C loratadine, D fexofenadine, ANS diphenhydramine. Q167. Which drug is a second-generation antihistamine? A loratadine, B diphenhydramine, C clofeniramine, D promethazine, ANS loratadine. Q168. Which drug sickness? A scopolamine, B cetirizine, C loratadine, D fexofenadine, scopolamine. Q169. Which drug is a leukotriene receptor antagonist? A montelukast, B salbutamol, C ephydine, D ipratropium, ANS montelukast. Q170. Which drug is an inhaled corticosteroid? A budesonide, D prednisolone, ANS prednisolone. Which drug is a long-acting beta agonist? Salbutamol, D salbutamol, C atenolol, D propanolol, ANS salbutamol. Q172. Which drug is an anticholinergic modulator? A ipratropium, B salbutamol, C ephydine, ANS ipratropium. Q173. C paracetamol, C aspirin, D ibuprofen, ANS norepinephrine. Q170. Which drug is an injectable? A glycogen, B codeine, C morphine, D diazepam, ANS glycogen. Q175. Which drug is the first line anti-TB isomax. Q179. Which drug is a second-line anti-ACE cyclosporine B asparaginase rifampicin A atropine cyclosporine? Q180. Which drug is used in multi-drug resistance treating A beta-alanine B hexamyocin C rifampicin A atropine beta-alanine? Q181. Which drug is used in COVID-19 antiviral therapy A remdesivir B cyclophosphamide decloxacizumab remdesivir? Q100. Which drug is used in influenza A oseltamivir B remdesivir C citalopram D acyclovir oseltamivir? Q180. Which drug is used in rabies prophylaxis a rabies vaccine PPVMMR rabies vaccine?
नहीं नहीं एक्चुअली
मैं तुमको पठाई दीजिए ना के जी में
हाँ
Which
ರೂಮ್
vaccine
ಮೇಟ್
is
ಅಂತ
used in
ಹೇಳ್ತಾರೆ
tuberculosis A B C D
ರೂಮ್ ಮೇಟ್ ಮನೆ
B
ಅಂತಿಲ್ಲ
MMR
ರೂಮ್ ಅಂತಿಲ್ಲ
hepatitis B
हाँ
पठाई
Q181.
दीजिए देखो
हाँ आइए
সেটি নাম ফাম বাবা না সব
आइए
এটা দেখো মালাকি বোর্ড এটা করবো স্পেলিং এম এ এল এ কে
Which drug is used in organ transplantation A cyclosporine B aspirin C ibuprofen D
নিমিশা কিছুটা জানিস
paracetamol
দশ
cyclosporine?
বাড়ি আছে সংযুক্তা তাই
Q187. Which drug is a
দেখো
monoclonal
টাইম দিয়েছি
antibody A adalimumab B
8:30
aspirin C ibuprofen D
8:30 ରେ ଆସିବ
paracetamol
ବୋଲି ଦିଆଯାଇଛି
adalimumab?
ସେମାନେ 8 ବାଜିଲେ ଆସିବେ ଖାଇବେ
188.
ଆଉ ଯେବେ ସେ ଗୁର୍ଲା ଯିବାର ଥିବ ଆସିଲେ 10ଟା
In rheumatoid arthritis A methotrexate B
ଖରାଦିନ ଦେଖ ଜଲ୍ଦି
paracetamol
ସକାଳ
C
ଯିବ
aspirin D ibuprofen methotrexate?
ସେରେ
Q189.
ନଥିବ ଟିକେଟ୍
এটা
Which drug
actually
is a
ସକାଳ ବେଳା
pregabalin
ଅଛି ନା
A probenecid B allopurinol C colchicine D aspirin probenecid? Q190. Which drug
ହ୍ୟାଲୋ
is used in
ନିମିଷା
acute gout A colchicine B
ନମସ୍କାର
allopurinol C
ଆଚ୍ଛା ଆମର ଅଫିସଟା ସକାଳୁ ଅଛି ଏଡିଏମ୍ ସିଡିଏମ୍ଙ୍କ ଅଫିସଟା
Q191.
8ଟାରୁ ଆରମ୍ଭ ସରିବ କେତେ
Which
ଗୋଟେ
drug is used in migraine
ଆଚ୍ଛା
prophylaxis
ଏଇ
A
ଯୋଉ
propanolol B
ମୁଁ
paracetamol
ବନ୍ଦ
C
କରିଥିଲି
aspirin D
7:15 ବସି ଯୋଉ
ibuprofen
ଚିନ୍ତା କରୁନା 8ଟା
propanolol?
ବାଜିଲାଣି
Q192. Which drug is
ଯାହା
used
ହଉ
in acute
20
migraine
ଜାଗାରେ
A
ଅଫିସ
citalopram B
ହେଟା
propanolol
ଟଙ୍କା
C
କାଟ
ଗୋଟେ ବେଳେ ଅଫିସ
tenofovir
ସରିବ
ଘଣ୍ଟେ ଅଫିସ ଖୋଲିବ
ଗୋଟେ ବେଳେ ଅଫିସ ସରିବ
Q193.
ଆପଣ
Which
ସାର୍
drug
ଚିନ୍ତା
is an
କରନ୍ତୁ ନା ଆମେ ଯଦି
SSRI
ସାଢ଼େ
A
9ରେ ବାହାରିବା
sertraline B
ସିଧା
diazepam C
ସୁପରିଟେଣ୍ଡେଣ୍ଟ ବସିବା ସାର୍
haloperidol
ସାଇନ୍
D
ମାରିବ ସେ ଗାଡ଼ି
phenidone
ସେ ଆସୁଥିଲେ
sertraline?
ସିନା
ସେତେ
194.
ବୁଝିଲେ
ଆରେ
Which
8ଟା
drug
ବେଳକୁ
is a
ଅଫିସ
TCA
ଖୋଲିଯାଉଛି ଗୋଟେ
A
ବେଳେ
amitriptyline D fluoxetine C sertraline D paroxetine unscapulated? Q195. Which drug is a mood stabilizer? A. lithium B. diazepam C. haloperidol D. fluoxetine. Answer B. Q196. Which drug is an antiepileptic? A. Proate B. atenolol C. enalapril D. metformin. Answer valproate. Q197. Which drug is used in status epilepticus? A. diazepam B. paracetamol C. aspirin D. ibuprofen. Answer diazepam. Q198. Which drug is a typical antipsychotic? A. chlorpromazine B. fluoxetine C. sertraline D. diazepam. Answer chlorpromazine. Q199. Which drug is an atypical antipsychotic? A. clozapine B. haloperidol C. chlorpromazine D. diazepam. Answer clozapine. Q200. Which drug is used in Alzheimer's disease? A. rivastigmine B. diazepam C. haloperidol D. fluoxetine. Answer rivastigmine. Q200. Which drug is used in Alzheimer's disease? A. rivastigmine B. diazepam C. haloperidol D. fluoxetine. Answer rivastigmine. Q201. Which drug is an NMDA receptor antagonist? A. memantine B. donepezil C. rivastigmine D. eripramine. Answer memantine. Q202. Which drug is a cholinesterase inhibitor? A. donepezil B. diazepam C. haloperidol D. fluoxetine. Answer donepezil. Q203. Which drug is a sedative hypnotic? A. zolpidem B. paracetamol C. aspirin D. ibuprofen. Answer zolpidem. Q204. Which drug is a barbiturate? A. phenobarbital B. diazepam C. lorazepam D. alprazolam. Answer phenobarbital. Q205. Which drug is a benzodiazepine? A. lorazepam B. morphine C. aspirin D. ibuprofen. Answer lorazepam. Q206. Which drug is used in overdose? A. naloxone B. atropine C. quizidine D. diazepam. Answer naloxone. Q207. Which drug is used in benzodiazepine overdose? A. flumazenil B. naloxone C. atropine D. physostigmine. Answer flumazenil. Which drug is an opioid antagonist? A. naloxone. Answer naloxone. Which drug is a strong opioid analgesic? A. phenytoin B. paracetamol C. ibuprofen D. aspirin. Answer phenytoin. Q210. Which drug is a weak opioid analgesic? Tramadol B. morphine C. phenytoin D. codeine. Answer tramadol. Q211. Which drug is used in anesthesia as muscle relaxant? A. succinylcholine B. atropine C. diazepam D. morphine. Answer succinylcholine. Q212. Which drug is a non-depolarizing muscle relaxant? A. vecuronium B. succinylcholine C. atropine B. diazepam. Answer Q213. Which drug is used in myasthenia gravis? A. neostigmine B. atropine C. diazepam D. morphine. Answer neostigmine. Q214. Which drug is used in organophosphate poisoning? A. atropine B. neostigmine C. physostigmine D. glucamine. Answer atropine. Q215. Which drug is a cholinesterase reactivator? A. pralidoxime B. atropine C. neostigmine D. physostigmine. Answer pralidoxime. Q216. Which drug is a muscarinic agonist? A. methanachol B. atropine C. scopolamine D. ipratropium. Answer methanachol. Q217. Which drug is a muscarinic antagonist? A. atropine B. pilocarpine C. methanachol D. neostigmine. Answer atropine. Q218. Which drug is used in chloroquine? A. pilocarpine B. atropine C. scopolamine D. ipratropium. Answer pilocarpine. Q219. Which drug is used in urinary retention? A. methanachol B. atropine C. scopolamine D. ipratropium. Answer methanachol. Q220. Which drug is a beta-2 agonist? A. salbutamol B. atenolol C. propranolol D. methaqualone. Answer salbutamol. Q221. Which drug is a non-selective beta blocker? A. propranolol B. atenolol C. methaqualone D. bisoprolol. Answer propranolol. Q222. Which drug is a selective beta
चेस्ट
blocker?
एक्सरे में
A.
करते
methaqualone
हैं चेस्ट एक्सरे
propranolol C.
रेगुलर करते हैं
dimethyl
तीन जन के
Answer
प्रॉब्लम वाला चेस्ट एक्सरे रे
Q223.
ସେଦିନ ହିଁ 3 ଜଣଙ୍କୁ ଆମେ ରିକ୍ୱେଷ୍ଟନ୍ ପାଇଁ କହିଥିଲୁ। ଗୋଟେ ମାସ ହେଇଗଲା ଲେଖା ହେଇଛି ଏବେ କିନ୍ତୁ ଗୋଟେ ମାସ ଆଗରୁ ବାହାରିଥିଲା ଏଇଟା।
See propanol.
ରିକ୍ୱେଷ୍ଟନ୍ ଏବେ କରାହେଇଛି। ରିକ୍ୱେଷ୍ଟନ୍ ଏବେ କରାହେଇଛି। ମୁଁ ଦେଖୁଛି।
malignant hypothermia, A. Dantrolene, B. Atropine, C. Diazepam, D. Propranolol, UNS, Dantrolene. Q65. Which drug is a selective serotonin reuptake inhibitor? A. Fluoxetine, B. Diazepam, C. Haloperidol, D. Amitriptyline, UNS, fluoxetine. Q66. Which drug is a tricyclic antidepressant? A. Amitriptyline, B. Fluoxetine, C. Sertraline, D. Escitalopram, UNS, amitriptyline. Q67. Which drug is an antipsychotic? A. Chlorpromazine, B. Diazepam, C. Fluoxetine, D. Paracetamol, UNS, chlorpromazine. Q68. Which drug is a mood stabilizer? A. Lithium, B. Diazepam, C. Haloperidol, D. Fluoxetine, UNS, lithium. Q69. Which drug is used in anxiety? A. Diazepam, B. Haloperidol, C. Fluoxetine, D. Phenytoin, UNS, diazepam. Q70. Which drug is an H2 receptor blocker? A. Ranitidine, B. Omeprazole, C. Pantoprazole, D. Lansoprazole, UNS, ranitidine. Q71. Which drug is used in peptic ulcer? A. Omeprazole, B. Aspirin, C. Ibuprofen, D. Diclofenac, UNS, omeprazole. Q72. Which drug is a prokinetic agent? A. Metoclopramide, B. Ondansetron, C. Domperidone, D. Atropine, UNS, metoclopramide. Q73. Which drug is an antidiarrheal? A. Loperamide, B. Lactulose, C. Omeprazole, D. Ranitidine, UNS, loperamide. Q74. Which drug is used in constipation? A. Bisacodyl, B. Loperamide, C. Atropine, D. Ondansetron, UNS, bisacodyl. Q75. Which drug is an antitussive? A. Codeine, B. Salbutamol, C. Theophylline, D. Montelukast, UNS, codeine. Q76. Which drug is a leukotriene antagonist? A. Montelukast, B. Salbutamol, C. Ipratropium, D. Theophylline, UNS, Montelukast. Q77. Which drug is an anticholinergic bronchodilator? A. Ipratropium, B. Salbutamol, C. Theophylline, D. Montelukast, UNS, ipratropium. Q78. Which drug is used in COPD? A. Tiotropium, B. Atenolol, C. Enalapril, D. Digoxin, UNS, tiotropium. Q79. Which drug is an expectorant? A. Guaifenesin, B. Codeine, C. Dextromethorphan, D. Morphine, UNS, guaifenesin. Q80. Which drug is used in anemia? A. Ferrous sulfate, B. Metformin, C. Insulin, D. Atenolol, UNS, ferrous sulfate. Q81. Which drug is a vitamin D analog? A. Calcitriol, B. Retinol, C. Thiamine, D. Niacin, UNS, calcitriol. Q82. Which drug is used in osteoporosis? A. Alendronate, B. Calcium carbonate, C. Vitamin C, D. Iron, UNS, alendronate. Q83. Which drug is an antiplatelet? A. Clopidogrel, B. Heparin, C. Warfarin, D. Streptokinase, UNS, clopidogrel. Q84. Which drug is an oral anticoagulant? A. Warfarin, B. Heparin, C. Aspirin, D. Clopidogrel, UNS, warfarin. Q85. Which drug is used in shock? A. Dopamine, B. Atenolol, C. Propranolol, D. Verapamil, UNS, dopamine. Q86. Which drug is a vasoconstrictor? A. Adrenaline, B. Nitroglycerin, C. Amlodipine, D. Verapamil, UNS, adrenaline. Q87. Which drug is a beta agonist? A. Isoproterenol, B. Propranolol, C. Atenolol, D. Metoprolol, UNS, isoproterenol. Q88. Which drug is used in anaphylaxis? A. Adrenaline, B. Atropine, C. Diazepam, D. Morphine, UNS, adrenaline. Q89. Which drug is an anaphylaxis? B. Prazosin, C. Propranolol, D. Atenolol, UNS, phenylephrine. Q90. Which drug is used in migraine? A. Sumatrapan, B. Paracetamol, C. Ibuprofen, D. Aspirin, UNS, sumatrapan. Q91. Which drug is used in motion sickness? A. Scopolamine, B. Atropine, C. Diazepam, D. Morphine, UNS, scopolamine. Q92. Which drug is an anti-epileptic? A. Valproate, B. Diazepam, C. Fluoxetine, D. Haloperidol, UNS, valproate. Which drug is a barbiturate? A. Phenobarbital, B. Diazepam, C. Lorazepam, D. UNS, phenobarbital. Q94. Which drug is a benzodiazepine? A. Lorazepam, B. Phenobarbital, C. Phenytoin, D. Valproate, UNS, Q95. Which drug is used in schizophrenia? A. Haloperidol, B. Fluoxetine. fluoxetine C diazepam D amitriptyline UNS haloperidol. Q96. Which drug is used as a C haloperidol D phenytoin UNS surgery? Q97. Which drug is a sedative? A. Midazolam B. Fluoxetine C. Haloperidol D. Aspirin UNS